gathered here to actually talk about a very unique case, a 70-year-old old lady with co-morbidities with COVID. She came to she had gone to some other hospital, was denied medical help. She came to Malar. We stabilized the patient. We kept the patient for almost 3 weeks in the hospital, and then Dr. NKS took a very found a very small window of opportunity and did a very complicated surgery. 3 days later, the patient came out of the ICU and she became normal. In fact, you can see her live here. Just a couple of things I want to add. Malar has treated so far around 600 COVID positive patients with a 96% success rate. Many of the patients actually come for emergency surgeries, or they come with a lot of comorbidities, and we had a very all-round team, of anesthetists, ICU intensivists to treat them. So therefore, we have not, in the last 4 or 5 months, we have not shied away, like this case illustrates. We have not shied away from any case, even though the patient is COVID positive. We have never shied away from actually treating the patient for the problem that she is actually facing. With this, I will now pass the stage to Dr. NandkumarSundaram.
Thank you for coming over for this meeting. And this is what is important is this is a very challenging case for us, because this patient is a 70-year-old lady who has got a comorbidity. That means she's got a very associated other diseases like lung disease, and that lung disease was chronic obstructive airway disease. That itself is a very dangerous one to have for a chronic thing she's been suffering. Also, she's got diabetes, hypertension and heart disease. So all comorbidities were so high with this patient, and unfortunately at that moment she also suffered from COVID, and she got this virus, and she was having very high fever, short of breath, and she slipped and fell down and broke her elbow. So she had gone to elsewhere hospitals where they couldn't do it because it is such a high risk case because of the COVID positive with the shortness of breath and so many other diseases along with it. And this fracture itself is a very complicated fracture. So she was referred here to our team, and straight away she was taken to ICU because of her condition was so bad, and that had to be first sorted out. So she went for that, and ICU, our team of doctors, which is headed by Dr. Buddhadev and anesthetics heading by Dr. Vidya, and that has helped this patient to recover, because intensive care is very important. It's teamwork. It's not only just the orthopedic, but we have to see the patient as a whole. And this patient was admitted straight to the ICU, and it took first with a high level of oxygen to give, and with a positive pressure, her oxygenation was increased and she became better slowly. But it took her 3 weeks. Fracture is in the elbow. Elbow joints are very complicated because it is near the joint. If there is, and also the functionless it becomes. But to do the surgery, first of all, we can't do it under local anesthetic. I mean, this fracture is in the proximal limb, so where we have to give general anesthesia. So that is where our anesthetic team comes into play. And to get them fit for anesthesia first, the ICU doctors have done the work first, to get her oxygenation. So because this another complication with this patient is that we have to put her in a position where we put it upside down. This bone from there with the muscle, and so that we can approach here. And this elbow is complicated because of the vessels and the nerve and other things are in and around the joint. So you have to make sure that which goes around all around this place, and we have to put a plate there so that we get a full movement. So these are all a little challenging for me. We put both sides plates so that all the fracture has been reconstructed back. And this is the spot where we removed that bone, reflected and got it back. So once you do something like this, the bone is very weak. Because she's 70 years old, the ladies also have the problem of this, and she's got full function there. And now, after this, because we wanted to show after 3 months, once it's all joined, there's no point in showing able to do all her functions back. And since she was COVID positive and the patient is, we didn't want to put her here, so she's come on live. We can talk, we can ask for her interview also. That is even easy now with the FaceTime and the breathing. But I mean, because we are so experienced and our team.